on social media a lot about the Black Lives Matters movement, as well as the coronavirus before Memorial Day and the death of George Floyd. So, we have a lot of, the racism that we're talking about right now. It is persistent in the healthcare field, and the fact that the mortality of coronavirus among Somalis and among African Americans, minorities, is pretty significant, and that's one of the reasons why. So I recently received a call from many people, actually, as far as the treatment of patients who are Black, who are Somali, who are minorities in the hospital. And one of the things that I've seen is that there is there's a recommendation for them to opt out of treatment. There's an option for them to say, you know what, because you have all these medical problems and because you're African American, and it's used as a risk factor for you not doing well, that treatment is withheld. Okay, so, and they usually say, do not intubate, do not resuscitate, which means if they stop breathing on their own, don't put a tube down, and if their heart stops, don't restart it, don't do anything. So I wanted to do a little bit of community education on what that is. Okay, so when you go to the hospital, you're given an option of code status. Okay, the code status is if anything bad were to happen, if your heart stopped, if you stopped breathing, if your blood pressure dropped, significantly, what would you want us to do? Okay, and so the options are full code. Okay, full code. That's do everything. Give medications. Put a tube down if they need it. Give them blood if they're bleeding to death. Basically, do everything you can possible to treat whatever the underlying cause, to give that person the best chance of survival. Okay, so that is full code. The other extreme, the other end is DNR. Okay, do not resuscitate. If you hear DNR, it means do not resuscitate. And what that means is don't do anything. If their heart stops, don't do anything. If they stop breathing, don't do anything. Don't put a tube down. Don't give them any breathing treatment. It means don't do anything. Let the person die. Okay, that's what that means. There's another form called DNI. Okay, that's do not intubate. Okay, DNI means do not intubate. And what that means is if you stop breathing and you have a hard time breathing, and that's the main problem with coronavirus is, your lungs are infected and you have a hard time breathing, your oxygen drops, right? Intubation, putting that tube down, is the best treatment we have right now, okay? It's supportive care. But DNI, giving that option to, African Americans, Black, minorities, anybody who has a language barrier, giving that as an option to say they're going to do bad anyway, DNI, that is a health disparity. That is why more of us are dying from this disease, because we're being presented with the option to not do anything. Okay, so DNI means do not intubate, means don't do anything. Okay, so from full code to DNR, DNI. Okay, the first option you're going to be given is DNR, DNI. I've seen this firsthand, so there's really not going to be any convincing of that needs to be done. So what I want you guys to do is educate your community, your family, your friends about these options. Okay, when you go to the hospital, unless the person has end-stage terminal disease, they're going to hospice and they're dying, and you don't want to prolong their suffering. If it's a young, healthy patient who has a good chance of survival with the treatments that we have, full code is what you want. Okay, full code. Okay, you want intubation, you want a tube. Intubation basically means a tube down your throat to help support your lungs. Okay, so full code. Do not intubate is only if you have no other option and this person is terminal. Okay, do not intubate means don't put a tube down, and do not resuscitate means if their heart stops, do not resuscitate it. If their heart stops, we have patients who have coded, whose heart stopped. that that have multiple medical problems. I think I restarted a guy whose heart stopped right on the floor, and we did the CPR and everything on the floor. Within 4 days, he was out of the hospital. Right? So the survival rate inside hospital is much better than survival rate, if you have a heart attack or your heart stops outside of the hospital. We already know that. But if you want everything done for your family, especially if they're young and healthy and were completely stable before they went to the hospital, you want full code. DNR, DNI, if they present you with that option, tell them, explain why do you want them to be DNR, DNI? What is your reason? And if they use, they're African American as an excuse, that is a healthcare disparity. That is a bias. Okay? So if you have any questions, please leave it below, and I will try to answer it as much as I can. But this is an important teaching point that I keep seeing over and over and over. Okay? We need to know the language so that we can make good choices for our family members. All right? Assalamu alaikum.